Initially, I was drawn to it with patient care, helping them along in that journey. In my first few years, interventional radiology, performing ultrasounds, and mammography looks for little tiny calcifications. But sometimes if you do have that dense tissue, it appears as white on a mammogram. For mammography, we have tomo imaging, which is 3D filtering, so it's better able to look through that dense tissue.
Welcome to the Legacy Podcast, powered by MCG Career College, where we spotlight healthcare professionals who inspire through leadership, compassion, and innovation. Today, we're joined by Sara Hale, a seasoned sonographer with over 20 years of experience currently serving as Ultrasound Manager in Calgary for Canada Diagnostic Centres, where she oversees all aspects of a large and dynamic sonography department. Sara is passionate about breast imaging and education, not only guiding sonographers, but also helping patients better understand their imaging journey. She has been instrumental in expanding breast imaging programs in clinical environments and has shared her expertise as a guest speaker at major breast imaging conferences. Sara, thank you so much for being here. How are you today?
I'm very well. Thank you for having me.
Thank you so much. Well, I would love to start with your journey. I want to know that what drew you to this field, because you have been working in one of Calgary's busiest ultrasound department for more than 2 decades. Mm-hmm. And I also want to know that how your role has evolved through all these years.
Mm-hmm. Initially, I was drawn to it with patient care, helping them along in that journey. My role has evolved along the way in many different aspects. I have been lucky enough to work with a team of both practitioners, radiologists alike, in learning different dynamics. They taught me many things in my first few years, interventional radiology, performing ultrasounds and breast biopsies, really learning and developing a passion for that and helping those patients along in their journey. When it is a personal journey, it does contribute to their health, and it really benefits the patient.
Mm-hmm. Well, it's really nice to know about that pretty much all the people, when I ask them about healthcare and why you started it, they always say that patient care is the first thing.
Absolutely.
Now, this is like, it's October now. It is a breast cancer awareness month.
That's
so
right.
I do want to ask you a question about your role in breast cancer detection. Mm-hmm. You've been deeply involved in expanding breast imaging programs and advocating for early detection. From your perspective, like, what role does ultrasound play in managing breast cancer, and especially in patients with dense breast tissue?
Right. I think it definitely helps supplement the exam. The gold standard for early breast cancer detection is definitely mammography. Mm-hmm. And ultrasound is utilized alongside that in order to supplement those exams and seek out things that might be hiding in that dense tissue. Mammography looks for little tiny calcifications, but sometimes if you do have that dense tissue, it appears as white on a mammogram, which can be like looking for a snowflake in a snowstorm, essentially.
Oh, God.
So that's where ultrasound really comes into play. Screening ultrasound does help by looking through that tissue, looking for anything within, and better able to detect whether there might be a tiny mass or a cyst or a solid, anything like that. It does help the radiologist in diagnosing any complications with their case.
Thank you so much for sharing that. Well, I do want to ask you about something, because you do work with multiple different departments, and
Yes.
I know all of them are very important, and they play a great role in early detection or even detecting anyone at a later stage. Now, my question is about collaboration in care. So breast cancer care often requires collaboration across teams. How do you and your department work alongside radiologists and oncologists to ensure timely and accurate patient care?
CDC has a wonderful breast imaging program. We have a very passionate team. Our lead radiologist, Dr. Ifema Curley, she is also fantastic in helping patients along with that journey. Outside of our clinic, we do collaborate with different groups. Calgary has a wonderful breast health program run out of Foothills Hospital, where they have a team of nurses, oncologists, surgeons that meet with these patients. When they are at our department, they're scared, they're nervous, and that's something that we discuss with them and with their family doctor. They often come and see us again when they're coming for an interventional procedure, whether it's a biopsy or a fine needle aspiration, and then they'll go on to that breast health program and collaborate with the team there, who are just wonderful in explaining every avenue, whether it's benign or malignant, and what treatment they may encompass.
Good to know. Wow, it must be like hundreds of people at the same time working?
It could get up to probably a good team of 40 or 50, I suppose.
Wow.
I mean, it's a collaborative group throughout Calgary, and these surgeons do work with us well. We also see patients prior to surgery where we do needle localizations and put in a wire into the lesion that is to be removed surgically prior to them going to the hospital. So it is really a collaborative team.
That is very interesting to know. Now, I'm very excited to know about the technology behind ultrasound. You've seen ultrasound evolve tremendously over 20 years, from traditional 2D imaging to advanced modalities like elastography and AI-assisted systems. And how have these innovations changed the way you and your team approach breast imaging?
There have been a number of changes. I mean, in working over the last 20 years, we started on film. So I was working at film initially, and now it's all digital imaging and working on computers and such. For mammography, we have tomo imaging, which is 3D filtering. So it's better able to look through that dense tissue. With ultrasound, we have a new technology called ABUS, which stands for Automated Breast Ultrasound, which I'm very passionate about and utilize quite regularly in our practice at CDC. There are many different things, even interventional procedures. Again, the technology is just advancing every day. We are constantly evolving and learning, and we use continuing medical education in order to progress our learning, constantly attending conferences, online conferences. So we're always evolving with that technology and using it to better enable our patients in their care.
That's really great to know. I do have an additional question to that. So has it made the advancements in the technology, has it made it shorter in time for wait to get to know about the results?
I would say, yes, it has improved. We're able to see, I would say not in maybe gaining results, but more so just finding things earlier.
Okay.
Breast cancer used to be a poor diagnosis and finding things when they were advanced, and usually when it's a palpable lump. Now with breast health screening, we're finding things that are millimeters big, and we can deal with them quickly. On mammography, you can find these things when they're solely calcifications and they're not masses yet, and they're dealt with. That's called stage 0 breast cancer, and it can be dealt with very quickly. If it does happen to be a mass, how advanced is it? Does it involve other lesions? Are there lymph node involvements? All of these things that we look at, and then when we sample these things, they are sent to the lab, to the pathologist, and the pathologist looks at these and tells us what stage, what type of cancer, are they influenced by hormones, these kinds of things that all affect the patient's treatment. So it really is collaborative, and I do feel that it has advanced. With the ABUS technology, that is able to speed up the process in the sense that those patients have screening every year if you have dense breast tissue. And it is a 3D volumetric imaging of the breast tissue, which can be done in 10 minutes and better able to see year over year if there are any changes.
That is really great to know. Well, my next question would be about patient experience, because cancer detection, or even going for a mammogram, as easy as it sounds like, it could be very scary.
Yes.
And even when I talk to my mom, she feels hesitant to come to the clinic to do her regular checkup. And that's why I think it's very important about how a patient feels during that process. So I do want to know something from you, because you're known for your patient-centered approach and for educating patients throughout their imaging process. As I say, just like my mom, many people can come feeling anxious with potential, good or bad results. How do you and your team ease the fear and provide comfort?
I think a lot of it is talking to the patient and hearing their concerns, because it can be a very nerve-wracking exam. Patients coming in for mammography and, concerned about being squeezed quite firmly. But most patients come out of that room feeling like, okay, that wasn't as terrible as I thought. The mammographers are incredibly compassionate. When they come to ultrasound, much the same idea. They're concerned. What have you seen? I'm worried about results. And we do talk with those patients and say, you're here. You're doing your screening. You are doing the best thing for your health. If you're coming for your screening yearly, mammography and ultrasound, and having that done each and every year, you're in good hands. If you've had a family member that has had breast cancer, your feeling of anxiety can be a little bit higher. We have an incredibly compassionate team of sonographers, just breast imagers alike in our company, that are just fantastic with patients. And we do receive feedback consistently that they are very comfortable with their care. And that's what we do at CDC, is exceptional care.
That's amazing to know. Well, I would like to remind all our audiences that they should go for a mammogram.
Yes.
In case they are about 45 years old. But even if they're a bit younger and they feel like after doing a self-diagnosis or self-check, if there is anything abnormal, they should go for a mammogram, right?
Right. So typically the guidelines, it does depend on your personal history and with your family doctor. We do recommend starting at age 40 to have your mammograms and have a baseline from 40 to 50. And then depending on your particular history, family history, or genetics, that kind of thing. Do you switch to 2 years, 1 year? It's dependent on your personal circumstances. But those would all be explained by the radiologist to your family doctor.
Good to know. Well, my next question is for our students. At MCG Career College, we actually teach a diagnostic medical sonography diploma. And every year we have these students who go out there and work in different medical imaging clinics, just like CDC, for breast imaging. What type of advice would you like to give it to them?
I think the best thing is to always be eager to learn and ask questions. If you have that passion to learn and want to go into breast imaging, work with somebody in your department that is passionate as well. Work with a radiologist, ask questions, review cases, attend conferences, have that passion for learning, and you will learn a great deal. There are many different portions of ultrasound, but breast imaging has always been my passion. I've loved it for the last 20 years, and I know that there are so many paths that you can take with it, and you just help so many people.
Oh, that's amazing. You guys are saving lives. Now that brings to my last question about making a very big and a positive impact. You have been speaking about your passion at different conferences, at a podcast like this, and to patient and your peers every single day. Now, what type of legacy would you like to leave behind for future generation?
I think I would just like to be known for empowering other sonographers in learning, in teaching them breast imaging, and having that compassionate care for patients, for that exceptional care. I like to have patients that return to me every year and say, oh, I was hoping to see you again, and I'm so happy that you were involved in my care. And that's what I want to do. I want to help patients in their journey, whether screening or diagnostic, and ensure that they're well taken care of. And I want to be part of that journey for them.
That's great to know. Well, Sara, thank you so much for being here today.
Thank you.
And I know that many of the students want to be like you one day. So thank you so much for sharing all this valuable information today.
Thank you. Thank you for having me.
Thank you. Well, everyone, if you have learned something new or you have a question or a concern, you know what? Feel free to send us a quick note through email or through comments, or you can also reach out to Sara Hale through LinkedIn if you're inspired by her story. If you want to also start a journey as a sonographer, you also know where to come. Thank you so much for watching our episode. I hope to come back with new guest and new episode very soon. Till then, take care. Bye-bye. MCG, making communities great.